and very welcome to the Department of Pediatrics, Medcare Hospital Sharjah. I'm Dr. Fuad Khan, Consultant Pediatrician and Head of Department. I would like to introduce to my wonderful team of colleagues who are expert in different fields with various training backgrounds. First of all, Dr. Muhammad Hudayfa, one of our senior most.
Thank you so much. I am Dr. Muhammad Hudayfa. I finished the medical training at 2003. I am practicing pediatric for more than 15 years now.
Hello everyone, I am Dr. Abdul Majid, specialist in pediatrics and neonatology. I have got my training back from India and have got a fellowship in neonatology as well.
I am Dr. Soumya Sarin, specialist pediatrician at Medcare Hospital Sharjah.
I am Vipin Jose. I am the pediatric intensivist with Medcare Hospital Sharjah and has been a pediatric intensivist for more than 10 years.
So in Medcare Hospital Sharjah, in the Department of Pediatrics, how do we get along? We start from the small newborn babies and then we'll take you around to the span of life. So first of all, our mini world of neonatology and newborns. Dr. Majid is the boss over there. He can tell us what can we do.
We have got a level 3 NICU in our hospital where we take care of the premature babies from 24-week onwards and newborns having...
So that is something around 500 grams onwards.
Exactly. The tiny babies and also the newborns having various health issues like the infections, respiratory distress, lung infections and cardiac issues. And we have got a very good support team as well with the hospital and with around-the-clock service of trained pediatricians and very skilled nursing staff as well as state-of-art ventilators and other equipments.
Fantastic. So these babies, when they go out of NICU, they are still not safe enough to go in the world because of their immunity. So they do need lots of different support. For example, vaccinations. So Dr. Soumya, would you like to tell us about some vaccination things that you provide over here?
Sure. As we all know, prevention is always better than cure. So talking about the prevention of childhood diseases, the utmost priority goes to vaccination. I'm so happy to say that our pediatric department at Medcare Hospital Sharjah is providing almost all the pediatric vaccines possible. And I'm so happy that we are providing the optional vaccines also for those people who wants to travel to other countries. And we follow the International and Ministry of Health guidelines here. So we encourage all the parents to vaccinate their children and give them a healthy and happy life.
So Dr. Hudayfa, would you like to tell us what kind of diseases we expect and what do we do, please?
Sure. Actually, we face, especially in this season, many respiratory tract infections, asthmatic patients, pneumonia, bronchitis, all of these things. And alhamdulillah, many cases was challenging and many cases discharged safely to the home. In case for any deteriorations, I think Dr. Ibn, he can take care of the situations and he can tell us what kind of service we can offer.
Thank you. So pediatric critical care is no longer an emerging specialty. It's already an established specialty. But then we need to clearly know that it's no more, children are not miniature adults. They are themselves different set of patients, different set of challenges, entirely different physiology. So I believe at Medcare Hospital Sharjah, we are up to facing any challenges which a complex pediatric patient can possess. Can range from, say, asthma exacerbations, severe pneumonias, pediatric autoimmune diseases.
To the ventilation as well.
Exactly. So, yeah, that rightly pointed out. Could be a spectrum from something like just oxygen, then could go into a non-invasive ventilation, invasive ventilations which require prolonged ICU stay. When pneumonia gets complicated, as Dr. Hudayfa was saying, we may need to put a chest tube to drain the pus out. So is the case with many diagnostic procedures in pediatrics.
So it is kind of a thing, the same thing which we expect in the newborn babies in NICU, it is more of a pediatric age group. And more important, what my point is, it's not only us who does these things, we all work together, but the parents' involvement, family involvement is also very key, especially in these areas. That is so important to mention.
Actually, I agree with you. As pediatricians, you have to deal with the child and you have to deal with the parents.
Exactly.
So these two parties, you have to know how to handle them. They have fears, they have concerns. If they didn't get the answers which they are looking for, they will be scared more. Other things that it's really rewarding specialty because the child will deteriorate very fast.
Very fast.
So if you give the right treatment, the recovery will be very fast.
And let me add over here, Dr. Majid, that actually includes even before the baby is born, sometimes premature babies, something. So you talk with the parents even before the baby is born.
Exactly as you mentioned, we start treating the premature babies from the antenatal period itself. We, depending upon the gestation and the mother's condition, we start counseling them, giving the support and get them ready to be delivered. And from there we start the neonatal care.
And when these babies or children, they're going home, we do not leave them like that. They always come back in our clinics, and I'm sure we take care of them in the clinics as well.
Yeah, sure, doctor. Because treating a child or treating a disease is not only treating only the disease. It is dealing with the whole family as a whole. So I think in our department, we do it in a good way.
In the end, we all must thank you to our esteemed patients and parents for showing a lot of trust onto us. We assure you we will always treat you well. Thank you very much.